Hi, my name is Jeff Reed, and I have bipolar disorder. And today I'd like to talk about the difference between what normal people who don't have a mental illness and people with mental illness. The difference between what they view as depression. Most people, when they get depressed, it's over circumstances of life. They've lost a loved one, or they've lost a job, or things just aren't going well, and they feel down, and they've got a case of the blues. And that, of course, is a form of depression. But depression, the way people who have a mental illness have to deal with it, it's an illness. It's deep, debilitating depression that that we can't just snap out of it. It's an illness, and when our severely ill brains are offering up ways to end it all and suggestions, reasons for why we shouldn't continue living. Positive thinking just doesn't work, and neither does making gratitude lists or anything of that nature. A lot of times people with mental illness have to be hospitalized for their own safety when they're deeply depressed, and I've been there before. Last year in October, I had to be hospitalized. It was a year ago now. I had to be hospitalized for a severe depression. I was suicidal, and I had plans and intent to end my life and end my suffering. And when you're that deeply depressed, there's no fun in life. I've got an online friend who thinks that I get some sort of fun out of posting on Facebook when I'm deeply depressed. And while I do appreciate the the help and the support that I get from my family and friends online, there absolutely is no fun involved in posting when I'm depressed. I don't get any sort of pleasure or joy out of the responses I get. It's just deeply appreciated because I know people care, and they want me to get well, and they want me to continue living. So, there is a difference between people who just have a case of the blues over circumstances in life that aren't good, and people who are mentally ill and experience depression as an illness. And, the illness has to be treated with people who understand, have an understanding of what the mentally ill person is going through. And it needs to be treated with medication and therapy. There is no snapping out of it. Anyway, I hope that helps bring some understanding to the subject. Thanks.